So good morning all. Today's topic of discussion is oral submucous fibrosis. So oral submucous fibrosis, it is a potentially malignant disorder, and Schwartz was the first person to bring the condition as atrophica idiopathic mucosa oris, and condition also described as idiopathic scleroderma of mouth, idiopathic palatal fibrosis or sclerosing stomatitis. Coming to epidemiology, arachidonate-derived products have several million consumers in southern parts of Asia. So the habit of chewing betel quid containing fresh, dried or current cured arachidonids is widespread in India, Pakistan, Bangladesh and Sri Lanka. Pinberg has defined OSMF as an insidious chronic disease affecting any part of the oral cavity and sometimes pharynx, although occasionally preceded by associated with vesicle formation. It is always associated with juxtaepithelial inflammatory reaction followed by fibroelastic changes of lamina propria with epithelial atrophy leading to stiffness of oral mucosa and causing trismus and inability to eat. Even though it is a lengthy definition, you have to know about this. Coming to the etiopathogenesis, the main cause is betel nut, then tobacco, chilies, lime, nutritional deficiency, mainly vitamin B complex deficiency, defective iron metabolism, microcytic hypochromic anemia. Bacterial infection, collagen disorders, immunological disorders, altered salivary component, increased pH, low calcium level, increase in alkaline phosphatase and potassium, and it has also got a genetic susceptibility. Clinically, it affects both sexes. 20 to 40 years of age are more commonly affected, and the sites mainly are the buccal mucosa, retromolar area, soft palate, palatal fosses, uvula, tongue, labial mucosa, and it may involve the floor of the mouth and gingiva. Prodromal symptoms mainly include burning sensation of the oral mucosa, hypersalivation, dryness of the mouth, vesiculation, ulceration, pigmentation, and defective gustatory sensation. And the late symptoms include gradual thickening of the oral mucosa, difficulty in opening the mouth, difficulty in tongue protrusion, difficulty in swallowing, referred pain in ears, deafness, and that is mainly due to the occlusion of the eustachian tube. Blanching of the mucosa, as you can see in this clinical picture, that is also called as Betel-Schwarz mucosa. Then fibrous bands can be palpated, circular bands over rima oris like a thin band, fibrotic changes and clear delineation of soft palate and hard palate, depapillation of the tongue. The gingiva becomes fibrotic, blanched and inelastic, pigmentation, ulceration, vesicle formation and petechiae. Now coming to the clinical and functional staging, SM Haider et al. Has clinically staged as stage 1 is fascial bands, stage 2 fascial and buccal bands, stage 3 is fascial, buccal and labial bands. And coming to the functional staging, stage A is mouth opening less than or equal to 20 mm, B is mouth opening 11 to 19 mm, and C is mouth opening less than or equal to 10 mm. Histologically, there is atrophic epithelium without retiridges, juxtaepithelial hyalinization, fibrosed connective tissue, and the muscle fibers get degenerated. It is grouped into 4 stages, mainly very early stage, moderately advanced, and advanced stage. Differential diagnosis of OSMF is first one is scleroderma. The similarity is because it has got both OSMF and scleroderma, there is reduction in mouth opening and palpable fibrous band. Whereas the differences are there is pallor of the mucosa and burning sensation that is seen in OSMF. Then second is anemic stomatitis. Again, the similarities present are there is paleness of the mucosa and burning sensation. And the difference in anemic stomatitis, we don't see the reduction in mouth opening, and also fibrous palpable bands cannot be seen in anemic stomatitis. Third is amyloidosis, and fourth one is generalized fibromatosis. Investigations mainly biopsy, as we have already discussed with it, histological features. and hematological findings, serological findings, immunological findings, and biochemical factors. Treatment and management, mainly therapeutic management. There is first one is corticosteroids. It suppresses inflammatory reactions, lowers the fibroelastic proliferations, and mainly the dosages dexamethasone 4 milligram intralesionally or submucosally at 2 to 4 days interval for 1 to 4 months. Then the second alternative is hyaluronidase, that mainly the function is lowers the collagen formation and lowers the viscosity of intercellular substances. Dosage is 1500 international units in 1 ml of 2% lignocaine hydrochloride, that is injected mainly intralesionally. And then a combination, there is 4 milligram bednisolone, 1500 international units of hyaluronidase, and 1 ml lignocaine injected intralesionally or submucosally at 4 to 8 days interval for 1 to 4 months. The next option is collagenase, that is 2 milligram collagenase in 1 ml distilled water, that is given weekly or bi-weekly. Then placental extract can also be given, that is aqueous extract of human placenta. It acts as a biogenic stimulator. It mainly contains nucleotides, vitamins, amino acids, fatty acids, and trace elements. Mainly the action is it accelerates the cellular metabolism, aids in absorption of exudates, and stimulates regeneration process. And the management, vitamin A is given, vitamin B1, B6, B12, antioxidants are given, and a capsule of vitamin E and C. Locally, hydrocortisone can be applied, metrogyl, chlorhexidine, gluconate, and local antibiotics. And surgical treatment, mainly conventional treatments are done. Then flap surgeries, it can be used as a graft, and implantation of fresh human placenta. Nasolabial flap, bilateral palatal flap, oral stents, laser, cryosurgery, oral physiotherapy, and diathermy. No treatment is effective in patients with OSMF, and the worst thing is that the condition is irreversible. So OSMF, as we all know, that is a chronic precancerous condition. Now it is called as a potentially malignant disorder, and arachinet is the main etiology that causes the condition, and we can prevent this condition by avoiding the use of arachinet and their product. So the sad part is that once the OSMF is, we have a patient that is coming with OSMF with reduced mouth opening, or that stage is irreversible. So the treatment is not to further proceed with the or deteriorate the condition. Thank you.